I'm Kia from BHA for Equality. So today we are having a session, which is a session that we were going to have during local testing week, focusing on HIV and to basically just have a discussion to educate people on different factors around HIV and how it affects our community. So like I said, I'm Kia. I'm a community engagement and development worker for the PASH Partnership, which is a partnership with LGBT Foundation, BHA for Equality and George House Trust, and we roll out sexual health services across Greater Manchester. So I'm joined here today by my colleague, Jeff. Would you just like to introduce yourself?
Hi everyone. My name is Jeff Okiri. I'm the Community Engagement and Development Worker for BHA for Equality. I work under the Hive project, an initiative that is in partnership with, like Kia said, with George House Trust and the LGBT Foundation. Well, I just need to tell you a brief information about the Hive project. The mission of Hive is to end all new cases of HIV transmission within a generation, and we aim to do this by delivering a comprehensive sexual health program for the Greater Manchester area, which includes HIV testing, access to low cost condoms, and support for adults and children living with HIV. Yeah, so that's it.
Thank you for that quick intro, Jeff. So I think in terms of before we get into our conversation, I thought it would be really good to start off with a question to ask, what is HIV and why is it important in particular for our community to know what it is?
Well, HIV, in definition, is the human immunodeficiency virus. It is a virus that attacks the cells that helps the body fight infections, and making a person more vulnerable to other infections and diseases. That's what HIV is, a virus that comes into your body, attacks the immunity in your body, and then leaves your body vulnerable to any other infection that might come up. But before we go deeply into this discussion, I thought it'd be nice for us to know a bit of, why we are doing this and why we want to promote reasons why people should test on a constant basis, why we want to give information about the preventive measures out there in terms of acquiring HIV. And that is why it's important that we do this. Well, in the UK, there are approximately over 106,000 people living with HIV. In the UK, 106,000 people living with HIV in the UK. And in that number, 1 in 4 are unaware of their infection. They don't know that they are carriers of this infection. And people who are not aware are highly likely of passing on the virus to somebody else because they are not aware. But those who are aware actually can go on medication and then prevent onward transmission. So these are one of the reasons why we're doing this. And the HIV epidemic is largely concentrated amongst men who have sex with men and Black Africans, actually, and in the UK. So you could see that those who have sex with men, have the propensity of acquiring HIV and, passing it on, and also amongst the Black community as well. So that is why we want to push those down, because we are an organization that reaches out to those within the BAME community. We felt that it's important that we, let you understand the reasons why HIV is prevalent amongst our communities and how that can be prevented. And also you have to understand that late diagnosis is higher amongst Blacks, 66% compared to whites at 61%. And also Black represent 34% of people diagnosed with HIV. In the UK, Black represent 34%. And if you look at the proportion between Blacks and the white indigenous, you find that there's a big disparity. I think we're about, is it 3% or so? And for us, if we are about 3%, and then and in terms of number of people living with HIV in the UK, we're 34%. That is high number, it is something that is worrying, and that's why we really want to combat this. So 66% of African men and 61% of African women are diagnosed late.
Mm.
And because we don't want to test, we don't want to interact with clinical settings, we don't want to have those one-to-ones and check our health on a constant basis. We are diagnosed late, and if you look at the number of people who are dying with COVID-19, you will see that Black and ethnic minorities are actually high in the number of those who are dying of it. And the reasons why is because many of them have underlying conditions, and those
Mm.
underlying conditions are leading to the death of those in that community, in our community. And HIV can also be a contributing factor if they're not aware of it, because if you're aware of it, that's fine. But if you're not aware of it and it has taken a toll on you, when COVID-19 appears, it then becomes very, very serious. That's why we want to push for this,
Yeah.
and then less than 1 in 5 of the Black population attended an STI clinic in the previous 5 years. So you can see that it is important that we make people understand the need to interact with your sexual health clinics, the need to interact with your GP, and you need to get this information and become proactive with preventing yourself from acquiring HIV. So, like I said, HIV is a virus that attacks the cell that helps the cell that normally helps the body to fight against infection, so making the person vulnerable to opportunistic infection that will come in the event of you acquiring HIV.
Yes. I think that's a really good point as well. One of the things that you mentioned in terms of sometimes the lack of knowledge that people do have in terms of why in particular is actually affecting the Black community, and a lot of the stats that you provided really do provide good context as to how it's
Mm,
affecting our community in particular, and the fact that in terms of statistics and how many Black people there actually are in the UK, the numbers are not reflective, it's disproportionate largely.
mm,
So another thing that I think would be quite interesting for us to explore is to then discuss another stereotype that happens within our community. Often people don't really have an awareness of the differentiation between HIV and AIDS. So, what would you actually classify as the difference?
well, it, AIDS is in definition is called the acquired immunodeficiency syndrome,
Mm-hmm.
which developed when HIV has caused serious damage to the immune system. So when HIV gets into your body, it targets what they call the CD4 cell, and the CD4 cell has what they call the receptor at the at the edges of the CD4 cell, which is the CCR5. So it goes and attaches itself and then enters the CD4 cell, which is your immune system, takes over the CD4 cell and converts it to HIV, and then begins to multiply. So your body, that CD4 cell, which is your immunity, which is supposed to really be there to fight against infection, then becomes replicated in the form of HIV across the body, and that continues to generate new HIV,
Mm-hmm.
and sorry, yes, a new HIV. Even though your body will keep generating new CD4 cells, what happens is that because the dominance of HIV in your body as a result of the strong nature of the virus,
Mm-hmm.
your body begins to lose strength and your CD4 count begins to go down. And when your
Mm-hmm.
CD4 count, which is your defense mechanism, as that begins to go down, then the HIV while the HIV continues to multiply,
Mm-hmm.
it then becomes apparent that you lose the immunity in your body, and when
Mm-hmm.
you lose that immunity, so when disease when um, infections appear, when they cold, pneumonia, cancer, tuberculosis, they all come to your body. Your body just don't have a way of fighting against them, because every time you have to understand that not every time you fall sick, that your body constantly fights against infections. Is
Mm-hmm.
when sometimes when your body is fighting and and you fight, your body is fighting, and then it becomes a bigger problem. That's when you begin to develop symptoms, and
Yeah.
then you have to use external medication to help the immunity fight better. So your body continues to fight against infection all the time.
Mm-hmm.
When that is in the fight against infection is not there, then your body becomes damaged. Your immune system
Mm-hmm.
becomes damaged. So when cancer comes in, when tuberculosis comes in, and every other infection comes in, it just takes hold of your body. And because there's no way of fighting against it, if you don't get the treatment and the help from the NHS or anywhere, you die. So that's the difference between AIDS and HIV. So HIV itself is just a virus that comes and attacks the body. It doesn't kill you. It's just a virus that can, that comes and attacks the body. But AIDS is when HIV has taken a toll on your body, and it takes some time to do so because your body will keep fighting and fighting and fighting. And when you take a toll on your body and your body does not have immune mechanism to fight against any infection that comes to your body, so cancer comes, tuberculosis comes, and everything comes, it just overwhelms your body, takes over your body, and then you might end up dying. So that's the difference between HIV and AIDS.
Mm-hmm.
I hope that's clear. I don't know.
So what are some of the primary transition routes for HIV?
Transmission?
Yes.
Okay, transmission. Well, there are a number of transmission routes for HIV, but the predominant one is sex, sexual activity. So you most likely getting it through sexual activity, but also needle sharing and syringe sharing as well. Blood, which is certain body fluid, blood, comes and pre-coms and all that, and erectile fluids as well, vaginal fluid and breast milk. These are the common ways of acquiring HIV.
So taking on from what you just mentioned then, if a child is born to a HIV positive mother, is it possible that they will also test positive for HIV?
Well, if a child is born to a positive mother, if the mother is not aware of the HIV status, and if when they go for delivery and the clinicians they're not aware of the mother's HIV status and they do not carry out a test on the mother, then when if that child is delivered, that child has the potential, 90% or 100% of acquiring HIV, because there would be, because blood exchange and everything, blood can come out, and during that time, the child can be, child can be can be affected with HIV. But what is the difference between that and current medical advances is that today, when a mother is tested positive, because when you get pregnant, you go for antenatal care, don't you? And when you go for this antenatal care, they will test if you have HIV. And if they test and you find out that the mother is HIV positive, immediately they will put the mother on medication. Yes. And what this medication does is that the medication would completely bring the mother's virus, the viral load. I told you about the multiplication of the virus. So it brings that multiplication down, and then the virus hides away. They hide in the cells, so they do not become effective anymore. They become sleepy virus. They go to sleep. So because of the medication, which is antiviral medication, so at that point they become undetectable. And then when they become undetectable, that child can be delivered without being positive. So that's why today, in today's contemporary world, across the globe, except in areas that is very, underdeveloped in terms of medical care, any child that is born from an HIV mother who is positive comes out negative because of medication. So as long as the mother is put on medication, the child can be delivered negative. So there are lots of people who are HIV positive, their mothers are HIV positive, but their children are negative because of the medication that are being administered on the HIV positive mothers. Yeah.
So I think leading on from that, in terms of awareness, we've mentioned and discussed a lot of the definitions and some of the stereotypes around HIV, but I think it's really important also just to define how would someone be able to tell in terms of symptoms if it's possible that they could potentially have HIV.
Well, there are people who will not have symptoms, but there are people who would develop symptoms. There are those who develop like a lump around here. I don't know. And that might grow, and they will feel very unwell, and you can then present to the hospital. But there are some people who will not even develop symptoms at all. There are those who would be like flu-like symptoms, and then after some time it would fade off, and then they begin to live normal again, and everything will be fine. But prior to then, they won't. Even while they live, just continue their lives, they won't realize that they're HIV carriers. But but make sure you check yourself on a constant basis, because that's the only way you can find out. Because you can be HIV carrier and not be aware of it, and you just go life. Some people don't develop symptoms. I mean, a lot of people do not develop symptoms as well. But at the early stages of the incursion of HIV in your body, there would be reaction in your body. You will feel a bit unwell, but sometimes it subsides after some days, or maybe some days, a week or two, and then you become normal again, because your body at that time fought against it. You fought against it, and but what happens is that whenever HIV gets in your system, it doesn't go away. So even as the body is fighting against it, it will come back again, keep fighting, and then the CD4 count begins to reduce, and the HIV begins to multiply, and that is when it begins to, things begin to get worse. And you might not realize it might take years for all that to happen, but after some time, you will begin to feel unwell, and you begin to fall sick, and then you begin to get admitted to the hospital.
Okay. Thank you for that. I think that's really important, as a lot of these conversations sometimes can forget to include the symptoms that people need to look out for. So in terms of preventative methods, what can people use?
Well, there are a number of preventive methods. The most common preventive method are condom. You utilize a condom, but you might have to be abstinence is also one of them. You can abstain from sexual activities if you feel like, but also condom is the most effective means at the moment of apart from medication, of preventing HIV as well. But also the medication is another preventive measure. Preventive measure. There is what they call PrEP.
Yes.
PrEP is called pre-exposure prophylaxis. Pre-exposure prophylaxis, which is a medication you take that prevents you from acquiring HIV. So you take it, and then it prevents from acquiring HIV. And that is available in the Northern Sexual Health Clinic at the Adasage Center. You can go and then inquire about that, and you can be given that medication. If you think you are at risk of acquiring HIV, PrEP is available to you. It's a medication you take prior to sex that will prevent you from acquiring HIV. And that's what we call PEP, which is post-exposure prophylaxis, which is a medication that you take in the event of having exposed yourself to HIV. For example, you had sex with somebody, and the person tells you, "Oh, I'm HIV positive." Oh, okay, and I'm not on medication. So, and the person says, "Okay, you can go to the hospital, and then you can be given PrEP, PEP, which is post-exposure prophylaxis. That's another medication you can take. And for example, those who work in the clinic settings, for example, in the surgery, if they puncture their fingers or something, and they're working, that they were actually carrying a surgery on somebody HIV positive, and they're worried that they're going to get an HIV positive result, they can just go and take that that medication, and that would eliminate HIV within 72 hours. So it has to be 72 hours after being exposed to HIV. You have to take it within 72 hours after being exposed to HIV. That's called PEP. And also, there's what we call U equals U, which is which means undetectable means untransmittable.
Yes.
Undetectable means untransmittable. So it just simply means that if somebody is on medication, that person would achieve undetectability. So being HIV positive and having an undetectable viral load means you won't pass it on. You won't pass HIV on to somebody else. When an HIV positive person takes the treatment, symptoms can become undetectable. That means if you're HIV positive right now and they find out you're HIV positive, they will give you medication to take. This medication you will take for the rest of your life. But within 6 months, you see the HIV in your body, that's HIV that was multiplying before, begins to go down. And it goes down and hides in the cells. And they sleep in the cells. So but they do not become effective when it comes, in terms of your body. They do not have the capacity to go through the bloodstream to infect somebody anymore. You cannot even go through the bloodstream to infect somebody. So even when you have sex with somebody, you cannot pass HIV on to the other person because you have achieved what they call undetectability. Because the HIV has gone to what they call latency. It has gone to hide itself and, and becomes harmless.
Yes.
But you have to remain on medication. So those are the preventive measures. So with that, even when somebody sleeps with you, if you're HIV positive, for example, and you achieve that undetectability, anybody who have sex with you will not catch HIV itself.
Yes.
Will catch HIV. So what we're trying to do with the Hive project is that we're trying to help people understand that anybody who is HIV positive can be put on treatment. And because we want to identify every single person who is HIV positive, put them on treatment. And when we put them on treatment, it means that the population becomes immune to HIV because all the people who are on treatment cannot pass HIV on. So even when they have sex with anybody, no transmission. So that is what we want to achieve. We want to achieve in a world where HIV will not be transmitted.
Yes.
That's what the Hive project is. It's about ending all new cases of HIV transmission within a generation. So by 2030, we want to ensure that no new cases of HIV is transmitted. No new person acquires HIV by 2030. Because every single person in the UK who is living with HIV has been identified and then put on treatment. And those people cannot transmit it because even when they have sex, they cannot transmit it. So that's the aim of Hive. So these are different preventive measures: condom, abstinence, PrEP, which is pre-exposure prophylaxis, what you take before sex, PEP, which is post-exposure prophylaxis, what you take after sex, and then you as an HIV positive person who is on medication will not transmit HIV. So you can have sex with anybody and nobody will catch it as a result of you having sex with them.
Thank you for mentioning all of those, as I think it's really important for people to know what is actually out there for them. So if somebody wants to get tested, how can they go about that?
Well, we have different means of getting tested. If you want to get tested, just go on the BHA website, the bha.org.uk, and then you can access free HIV kits from there. You can order for HIV kits, and that will be sent directly to your home address. And with that, you can then request, and you can carry your test, and then you post it and send it away, and your test will come, and your result will be sent to you through text messages to your phone. So you can go on the bha.org.uk, the bha.org.uk, or you can go to the sorthiv.org.uk, sorthiv.org.uk. You can go on these two websites and you can order for HIV tests through these platforms, to different platforms. And this test will be delivered to you at your home, and then you can carry the test on yourself, within your own environment, within your own confidential environment, and then you carry this test and you send it away, and the result will be sent back to you.
Thank you for that, Jeff. Likewise, if you also would like to order condoms and lube on both of those websites, there's details for you to be able to do so. So please make sure to utilize those websites so that you're able to still access HIV kits and condom and lube kits as well.
Yeah. And they're all free, actually. The HIV tests are free. The condoms and lubes are also free. So you can order as much as you want. You can keep coming back to order. They're all free of charge.
As long as you're based within the Greater Manchester area. So thank you today, Jeff,
Sorry?
this session, as that was a really good session that we were able to cover so much around HIV. So would you like to say any last things before we end the session?
Well, I want to say thank you very much. I hope you enjoyed the session. I hope you learned a lot, and I hope you're going to be very proactive in terms of preventing acquisition of HIV. And I hope you're going to utilize the website we've just mentioned to order for tests for yourself, order for your family, order for your friends, and inform your friends about it. And we will live in a HIV-free world.
Yes, thank you so much.